Good evening, everybody. Welcome to our farewell party to Wrinkles. So that's what they say, goodbye Wrinkles. This is a farewell evening, farewell party to Wrinkles. Anyway, this is basically a botulinum toxin cosmetics. Now you all understand the cosmetics coming up very fast everywhere, all the countries, particularly in Colombo. For the last 10 years, we have seen a huge growth for a demand for any cosmetic surgical and non-surgical procedures. And so today we are going to say bye to wrinkles through this botulinum toxin. The story starts in 2006. So that is where first we had this kind of evening or party. It's called, this is party for Mrs. Sri Lankan finalist. So what we did, some surgical makeup or botulinum toxin makeup for them for the final contest. Yeah. This is how we started. So that was me 12 years back. So you can understand that it's not worth getting old. Yeah, everybody agree that? Yeah, that's what. Okay, but we can't avoid that. But we can slow down that. We will slow down that changes. We will never avoid that. We will never win this war. We will fail. We will lose the battle. But we will slow down the aging and the appearance of aging there. I'm a good example here. So this is some of the finalists. Mrs. Sri Lanka finalists there. We were giving some botulinum toxin therapy for them to fit the contest in that time, 2006. Coming to the topic, this is what we are going to discuss today. Let's see how the botulinum toxin developed in the cosmetic field. It's very interesting. So a little bit of history we'll see. And we'll see what is this botulinum toxin and what are the target tissues in the body we can treat. What are the areas? And how do we prepare the patients after the understanding of mechanism of action? Then we'll see some cosmetic usage clinical cases. And after that, if you have any question and answer, we'll discuss that. So after this discussion, we will have some kind of demonstration. So you see how we are injecting, what part of the face or which part of the body we are injecting, what we are going to get it. If you look at the history, 1960, ophthalmologist started to treat for the squint. That is the first usage of botulinum toxin in the history, 1960. So they treat this. This is the man who discovered this. He treat this squint. After that, they started to treat spasm. We call that blepharospasm or hemifacial spasm. That means the round eye or one side of the face always spasm, always like a twitch there. You must have seen people like that. It's twitching always. So started from there, then started to treat this spasm. That means always it's like a closed eye. It's like a functionally blind eye. Right. Then what they have noted, when they started to treat it for the eye disease, they noted the wrinkles gone. Yes, look at this. Other side, the wrinkles there. But this side, the wrinkles gone. But they didn't know about that time wrinkles and the botulinum toxin association. But they treated for the spasm. They found the wrinkles also disappeared. Interesting point. Then in 1992, then scientifically they claim this botulinum toxin is good for all the wrinkles around the eyebrow. Very logical, very scientific. Yeah, very nice history. So 1960 they started. 1992 they say you can use this for botulinum toxin. I started to do in 2000. That means 8 years back. After 8 years of this discovery, I started to do that. Time I was in UK. Started to do this for the wrinkles. So we are not that bad. We are behind, but not that bad. Structure. So most of you want to know what is this? It's a protein. It's a protein structures. I'm not going into detail too much. That's useful for the doctors. It's the structures. With the structures, there may be one or two elements, maybe difference. The same main structure is the same, but there may be one or 2 points. The chemical is different. Then they have a different variety: A, B, C, D, F. What we use is a type A. In the world, we have type B also. So this Botox, Dysport, Xeomin, Toxin all come under type A. Type B also there. Same acting the same. The target tissue in the body, what are the areas we are targeting? We are using muscles. When I say muscles, all the facial expression muscles, I will go in detail later, all the facial expression muscles, this is how our face build up with the muscles to give us the expressions. Give us the expressions. And the jaw muscles, we have jaw muscles here, some muscles, jaw muscles here. And the leg muscles, I'll show you later. And the leg muscles. So facial expression muscles around the eye, forehead, nose, around the mouth, jaw, neck, and the calf muscles were leg muscles, and the jaw muscles and side of your face. And some glands we can treat, some problem associated with this glands with botulinum toxin. Salivary gland, I will tell in detail, some problem with the salivary gland, cosmetically ugly, we will treat that. Sweat gland, if somebody having too much sweat, we treat with the botulinum toxin. Oil gland, if somebody having too much oil in the face body, we can treat. So basically, muscle and the glands, the muscles, facial muscles, jaw muscles, leg muscles, and the gland, salivary glands, sweat glands, oil glands. I'll come in detail later. Whatever the target tissue, the mechanism of action, how it act. So if you take this muscle from the nerve, from the brain, there should be a signal coming to the muscles to move. So now, a signal coming from my brain for this hand to move this way, this hand to hold this, focus here. So this botulinum toxin acting on the nerve muscle junction or nerve gland junction, nerve muscle junction or nerve gland junction. And it calm down, it's not completely stopping the signal, calm down the signal. If I say the switch is here for this light or this fan, the current should come from the switch, and ultimately the electric current turning into mechanical energy or light energy. Imagine at that connection, if I can do to slow down something to that, the fan will work very slowly on it. It won't work faster, or the light will be very dim. That is what the botulinum toxin do. So in the muscles, it relaxes the muscle. It's not paralyzing the muscle, relax the muscles. In the glands, it says, okay, don't produce too much of sweat, calm down. Don't produce too much of oil, calm down. So this is, sometimes you all confused what it's really doing here. So this is what it's doing. In simple form, at the nerve muscle junction, nerve gland junction, it tells the organ to calm down, don't act too much. Not stopping the action, slowing down the action. So this is the mechanism of action, where the facial muscles, jaw muscles, calf muscles, salivary glands, sweat glands, and the oil. And the effect, you all are unhappy to see that it lasts only for 6-8 months. When you inject here, it takes 5 days, 1 week to see the results. 5 days, 1 week to see the result. Then the results goes up. This is the maximum results you would see in 2 weeks' time for the wrinkles or anything. If I inject here, it takes around 5-6 days for you to see the difference. Then you will see the difference goes up. Maximum results in 2 weeks. It will last up to 6 months. From there, it fades off. This is in the majority of the population. But 1 or 2, you or me may be out of this normal form. Some may be having this effect, finishing this effect in 3 months. Some may be having 8 months, more than that. But usually this is the effect. So that's what. After 6 months, usually you come for another treatment. After 6 months, 7 months, 8 months, you come for another treatment. How do we prepare this? This is how the drug comes. We add that with a saline and take into small syringes, like tuberculin syringes, it's tiny one, and we inject there. It's too much for you. You don't need to worry. But this you will be interested. How we are preparing yourself. How are you preparing the patients? We apply the EMLA. We apply this EMLA and leave that for 45 minutes, 40 minutes, 50 minutes. We'll just leave. So that will anesthetize the skin. That will anesthetize the skin. Plus, we will use some ice cubes. We'll keep the ice. Ice is also a very good anesthetic agent. Ice. Keep the ice cubes When it is numb, we can inject, you won't feel anything. But some people, they don't want anything. Doctor, don't waste your time, my time, just inject. So I do get some people. Some people are on other side, other end. Yeah, that can be. But usually, this is more than enough. If you put an implant and leave it for 40 minutes, you're fine. Yeah? But we can apply some ice also. Then we inject. This is the list of usage, cosmetic usage of botulinum toxin. If you see internet or the companies' brochures, you will see all expression line from here to the neckline, all these lines. Basically the wrinkles. Yeah? But this is a traditional thinking. Now we have gone beyond this. So actually this is beyond the wrinkles. This lecture or this meeting should say beyond the wrinkles. This is something for you guys to make a note. This should be beyond the wrinkles. It's not the farewell to the wrinkles, it should be beyond the wrinkles. I will show you with clinical situation, I will show how far we have gone beyond the wrinkles. How far we have gone beyond the wrinkles. So they say goodbye to wrinkles, but I would say beyond the wrinkles. Expression lines, forehead lines. Everybody has this. Yeah? This is coming because of these muscles. These muscles acting, contracting, sustain. So after some time when we come 40, 35, 40, it's always the enough. Yeah? If you are a very angry man frowning all the time, you will easily get it. I'm just kidding. Yeah? You will get it. So what we do, we inject this Botox. I told you earlier, we are relaxing the muscles. So we are depositing this molecule on the muscles. Ask the muscles to calm down, relaxing, not completely stopping the muscle action. Calm down. Look at the results. Look at these pictures. These are the lines. Very harsh. Let go. One treatment, it will go. 5 days, 6 days, 1 week, you will see these changes. Yeah? This is what now, girls, ladies, you want now. Another one. Girls, thanks to Botox. Frown line. This is what I say. If you are an angry person, you will get this easily. No, I'm just joking. The frown line. So these are the muscles. The muscle D and E. D and E. So that's what we put here and there. We are targeting to inject these two muscles, tiny muscles. But these two muscles. This is another muscles. See the results. A very young girl. Yeah, very nice. It will give a little bit of brow lift also. See these pictures. Very harsh. This is very harsh. I want to tell one thing. I had a patient, one patient. She come for this, she has only this line. Only this line, frown line. She is very young. You may wonder why a young patient getting this Botox. Her worry is her child asked, Mama, what are you You are angry with me. Why you are looking like that? Because of that only she comes. She is not coming because she want to look nice. But the child thinks, Amma is angry. See this line. Yeah? She is not angry. It is like that. But this line makes you sad. But look at this expression and frown lines. Both. Forehead lines and the glabellar lines. Typical. All Sri Lankan we have this. Completely disappear. Or smoothed down. That looks nice. And look at, because of this line, look at the shape of the eyebrow. So that gets freezed. Eyebrows now free. It's like a drawing now, eyebrow. Yeah? These eyebrows are like a drawing. This look, because of this line, these muscles I mentioned earlier. Claw feet lines. This one. That is here. This area. The muscles around this region. So we inject in that region. Some of you already know we are treating that. We inject that region around 3 points and you will get to relax. Immediately. 5-6 days, that all lines goes. And look at the brow, what's happened when we do that. The brow also lifted up. So brow also will be lifted up. Look at this one. Completely gone. It's like an iron cloth. Completely gone. Yes? Look at the brow. Brow go a little up, 1 millimeter, 2 millimeter up. Lip line is called smoker's line, but not necessarily smoker's line. Lip line. Lip line. Look at this one. That's due to these muscles. Yeah? This muscle. So we inject very tiny drop into that muscle. That means upper lip. It's around 4 to 8, 10 units. Look at this picture. And this one. These lines. These all lip lines, smoker's line. This is a good example of botulinum toxin therapy. Look at this one. After the treatment, how clear is that? It will make you around 10 years younger look. Give you around 10 years younger look. Bunny lines, the nose lines. The muscles, very tiny muscle here, but that creates this trouble. So we inject in this region and get rid of that lines, bunny lines. See that? This is severe one. Earlier one is a little mild one. This is very severe one. Chin dimple. Some of us will have a dimple in the chin. This dimple because the muscle is contracting. The muscles in the chin is contracting. So that's why it's getting dimple. So this is the muscle we are targeting. These are muscles. So we inject botulinum toxin in that region. Get a smoother, without the dimple. Look at this one. You see that dimple? We get a smooth chin appearance. Smooth chin appearance. Nefertiti lift. Nefertiti is the queen in the Egypt, and we surgeons and artists, we believe or take her face as an example of the face. Look at the neck, jawline, eyes, and we just follow that, the shape and the proportion. So that neck, the jawline, considered to be the ideal. So that is something like this. Yeah. When you are younger, when you are 25, 30, your jawline, necks are like that. Right? So when we are getting old, we are getting all these bands. That is due to these muscles. See that muscles? Starting from the upper level of the chest, going across the neck and touch the jaw. So you start from here, touch the jaw and come here. So all these lines, these muscles, these strands, we call them bands, we inject this botulinum toxin and relax it. So you get the well-defined lower jawline. It's called jawline, well-defined. Right? It's not pulling like this when you inject. So that's called Nefertiti lift. It's very popular nowadays, right? Nefertiti lift. So this kind of things. Look at this. These are mild form. Okay? From here to here. So this line became very clear. Look at this one. Yeah? Soften. Dissolve. Look at this one. So we inject along this line, along these bands, that muscles band, and relax it, get a smooth. We can do this with the surgery also. I do sometimes neck lift. We do the surgery. That's almost permanent. But this is only 6-8 months. You have to repeat it. But it's very simple. Brow lift is a popular surgical procedure. But after introduction of this botulinum toxin, sometime we don't do surgery. We do with the botulinum toxin injection for selected cases, not each and every cases. So what we can achieve is something like this, from here to here. Look at this eyebrow, and this give a puffy because this is drooping down. If you lift that up, it look little clean.